black woman and her husband are now suing Emory University-run hospital in Atlanta for medical malpractice, claiming she was denied emergency care for 2 hours. This led to the death of her unborn son. Crystal Beeling and Joshua McCrary filed the lawsuit in Fulton County Court. The suit accuses Emory Healthcare staff, which is in Georgia, of failing to provide medical treatment to the black woman. Here is how the horrific night at the hospital played out. The suit states that the couple informed at least 5 employees in the ER of her condition. This included severe pain in her stomach, heavy vaginal bleeding, and nausea. She claims the staff then ignored her for 20 minutes until she was asked to complete intake forms. She was 38 weeks pregnant. Ms. Beeling endured, quote, immense pain and stress as she waited and twice vomited in full view of hospital staff who continued to provide no care, she claims. She was then taken to the maternity emergency waiting room in a wheelchair and then placed along a hallway against the wall. She was told she had to wait because a shift change was taking place. She observed a new group of 3 or 4 employees take their positions in the maternity ER waiting room who failed to offer any treatment, examination, aid, or evaluation to her. One employee ate a meal right in front of her. And when she again posed the question, when would she get medical attention? Another one said, dismissively, quote, somebody's already talked to you about that, end quote. While the hospital staff continued to ignore her, Ms. Beeling noticed that her unborn son's previously vigorous kicking became less frantic and soon stopped altogether. Alarmed by that and still bleeding and in pain, quote, it was clear that defendants had no intention of examining or treating her, end quote. And Beeling then asked her husband to take her to another hospital. Their complaint states, the suit alleges no one attempted to speak with them. They eventually left, made the drive to a new hospital. Unlike the treatment she received at Emory, the staff at Piedmont Hospital snapped into action. Full disclosure, I happen to serve on the board of that hospital. She alleges upon learning Mrs. Beeling was pregnant and had vaginal bleeding, they put her in a wheelchair and rushed her to the maternity emergency room, where at least 5 doctors assembled around Mrs. Beeling and immediately triaged, admitted, and began to treat her, starting an ultrasound within minutes at 11:52 p.m. Despite the best efforts of the medical staff, the lawsuit says in the early hours of August 23rd, a physician told Ms. Beeling that her son had, in fact, passed away, dying of placental abruption. The next day, after natural birth did not occur, doctors induced delivery, and her son, Carmelo Arthur McCrary Beeling, was born dead. The complaint said the experience was for Ms. Beeling, quote, the most agonizing period of her life, lying in a bed carrying a child that she was told had already passed. This is certainly not the first time this has happened in Georgia. Georgia had the 9th highest infant mortality rate in 2022, with about 7 babies dying out of every 1,000 live births. According to data from the CDC, the overall infant mortality rate in the U.S. was 5.61 per 1,000 live births. Black infant mortality rate in Georgia was even higher, with 9 infant deaths.
I have an update to the racist nurse that was breaking the bones of black babies. This Virginia nurse was arrested last week for breaking the bones of black NICU babies. She worked at Henrico Doctors Hospital in Virginia. In summer 2023, a NICU baby was found to have a broken leg. But the mother of the child happened to be a NICU nurse herself, so she reported the incident to social services. After a year of investigation, social services concluded that the child's broken leg had been done by a staff member. The hospital placed Erin on paid leave for an entire year. This after 3 babies were found to have been with broken bones under her care. She returned to work in fall 2024, and during her absence, no children had any broken bones. But upon her return, an additional 3 children were found to have broken bones under her care. So in December 2024, the hospital decided to close the NICU unit to conduct a thorough investigation. And just last week, Aaron Stratman was arrested. My question is, if the hospital knew that something was going on with this nurse, she was targeting black babies and breaking their bones, why did they place her on paid leave? Why did they allow her back in the hospital? This hospital needs to be held accountable as well. And as far as this monster, she needs to be charged with a hate crime because the majority of the children she targeted were black babies.
We have a few new details about the NICU nurse who was arrested after 7 babies allegedly had fractures and other injuries. One of the victims' fathers, who has been very vocal, did an interview where he said the only correlation between all of the children are they are all males. So there are 2 black male babies and the rest are of mixed races. He went into more detail about his son's story, and you can come to the conclusion when I tell it to you. On September 1st, the mom went to the NICU to hold her babies, and she spent time there, and she went home, and the next day she came back by herself because the father had something else he had to do. When she came there, they told her that she could not hold the baby because it was at the nurse's discretion. This really upset her. Obviously, it would upset any mother, and she left the hospital very upset. Now, the following day, the father and the mother come back to see baby Noah. That is when they were informed that there was an issue with his leg and that he had a fractured tibia. Noah's parents assumed it had happened on this day, September 3rd, because that's when they were told, but later they went into their medical files and they found out that it actually happened on September 2nd, that Noah's fracture was reported several hours after the mother had left, the same day that the mother was not allowed to hold the baby. Now, after that, it took forever for the police to get involved, and then a month after they get involved, they decide to close the case. And then one day, Noah's dad received an article from a friend about more babies with fractures, and he could not be quiet. This led to more of an investigation, which led to the arrest of Aaron Stratman, the NICU nurse. Now, these first incidents of babies being injured happened in the summer of 2023. At some point, Aaron was put on paid leave, and then they brought her back, and there were more fractured babies. One baby apparently had 12 fractures. And now, all this time later, she's finally arrested. You can come to the conclusion on who you feel is all responsible for this, not just Aaron.
I'm heartbroken. Because I feel like I didn't do nothing for her.
She was the love of his life. Christine Fields and Jose Perez. The couple was engaged to be married, excited for the birth of their 3rd child.
Christine had no medical issues, nothing.
Instead of holding their newborn baby boy together, Perez is now wrestling with loss. 30-year-old Fields died shortly after emergency C-section surgery inside Brooklyn's Woodhull Hospital.
I have no answers. Why? What happened to Christine? I want to know what happened to Christine.
According to her family, Fields checked into Woodhull, a city-run hospital, on November 12th.
Always keeps the birth plan. All 3 children kept the birth plan.
But her delivery did not go according to plan. Fields' family tells New York One the doula she'd been working with wasn't on shift at the hospital. And while Fields was adamant she did not want C-section surgery, doctors told her it was necessary. And Fields' mother says after surgery, her daughter spoke up, asking for more medical help, only to be ignored.
Did you feel like her concerns that she vocalized were listened to?
No. At all. At all.
In a statement to New York One, Woodhull Hospital responded to the death of Christine Fields, saying, "The health and safety of our patients is our highest priority, and we express our sincere condolences to those affected by this tragic loss. NYC Health and Hospitals has a steadfast commitment to providing quality, dignified, culturally responsive care to all New Yorkers without exception."
We have not heard anything from the hospital, not an apology, not a sorry, not anything. No phone calls, nothing.
And one of the reasons this family is coming forward is because they don't want this to happen to another family. And we understand there have been problems at Woodhull Hospital before this with other families.
In July of 2020, 26-year-old Shaija Semple died in childbirth at Woodhull. Her anesthesiologist later lost his medical license. Semple's death led to calls for New York City to address long-standing disparities in maternal health care. Nationwide, Black women are 3 times more likely to die from a pregnancy-related cause than white women, according to the Federal Centers for Disease Control. Here in New York City, the disparity is deeper. City health officials say Black women are 9 times more likely to die of pregnancy-related complications than white women. For the first time in its history, the City Council passed a maternal health package of legislation last year, increasing resources. And Mayor Eric Adams has expanded access to free doulas in some of the city's most vulnerable communities. In recent days, family and friends of Christine Fields have rallied outside of Woodhull as their search for answers continues.
I want people to remember Christine.
I'm going to be vulnerable here for a moment. I hope you can indulge me. Good day, I'm Dr. Tia, and welcome to my page if it's the first time I'm seeing you. A few days ago, the United States President posted a picture depicting Michelle and Barack Obama as monkeys, apes, baboons, whatever you take it. I actually didn't see the video. I saw the screen grab at the end of the video. And this hit me really hard because I have an 11-year-old son. And last year, while he was in grade 5, I had to go into school and tell them that someone he thought was a friend had been calling him a monkey.
Old Spice Swagger Spray provides ridiculously long-lasting freshness. Ridiculous.
He didn't quite understand what a monkey or nigger meant, and so he didn't know how to take those insults. And this was brought up to me by his after-school care coordinator, who didn't know how to handle it because my son did not seem to be upset at being called a monkey or a nigger in the school playground. It hurt me to no end because my son's chocolate, I'm chocolate, and this is not the first time we've had to deal with racism in Australia. I wrote an article when my son was 3 or 4 for SBS, highlighting a journey on the train where my son and I were called by a man, random stranger, and he basically was yelling how we are the color of shit. I'll use that, his terms. We are the color of shit and do not deserve or need to be in Australia. In my clinical experience, in my workplace, I have been accused of stealing money from an elderly woman when, as a general practitioner, I don't actually ever handle money at all. I've had patients who, when I've called them and say, "Good day, I'm Dr. Tia," have been visibly upset because they thought that they were making an appointment with Dr. Tio, who they assumed was Asian. I've had those episodes of, "But where are you really from?" in my consultation room before a consultation can start, where I have to tap dance to prove that I am qualified to be the doctor in the room. This is not right, and this cannot be normalized. And how I am seeing this play out is harmful to everyone, not just the black and brown people who are made fun of in this context. Because when I go into the city and they're having a far-right march to say Australia for Australians, although Australians are actually Aboriginal and Torres Strait Islander people who are more likely to look similar to me in hue, I have to be mindful of where I go, and who might take offense or believe that I am here to cause harm to them and their loved ones. This is harmful to all of us, because the same people who say these racist and vile statements will present to my consult room, and I will have to, under my medical oath, provide care if I'm the only practitioner available and they are unable to get care from elsewhere. We are asked as medical practitioners of color to often abandon aspects of ourselves to care for people who would march on the street and cause harm to us and our families. So I am a general practitioner, and I see all sorts of people. And there are people who will make a statement, "Oh, I haven't been touched by a black person before. Oh, your English is really good for a black person." And my nervous system reacts to that in a way that I don't think people who are not people of color ever have to contend with. And when it comes from the highest office in the United States, the apparent leader of the free world, it is even more harmful. Because at my son's school, I had to have a conversation with his teacher about the repercussions for that child who was probably parroting what their parents were saying to my son. I had to have the conversation with my son about how those derogatory terms are meant to inflict harm on him. And as an African Australian, I come from Botswana, South Africa, Southern Africa. And so my parents, grandparents have a lived experience of apartheid. And I don't think it was ever a blanket ban that the criticism of the South African state and its apartheid regime was ever going to be massaged and considered normal in other spaces, and that the criticism was in itself wrong. We are human too, with lives and dreams and wishes for our kids just like everyone. And the disappointment comes when people who have privilege, white privilege, choose to comment only when white people start to be the ones on the receiving end of harm. When some of us have, through med school, through decades, been living with a society that will love your hands and your job and your productivity and your work as a doctor, but not see the humanness that you are. I had a manager who would touch my skin as if I was at a petting zoo. I had a supervisor in my training to be a general practitioner who got his kids to touch my skin as if I was in a petting zoo, whose frame of reference for Africa was the gods must be crazy.
What is the purpose of that?
He felt like that's where I came from. And so anything, my English, my tone, was all taught in Australia because of how backward we must be if the film The Gods Must Be Crazy depicted my heritage accurately for the time and date. This was in the mid-20s, 2010s. So I have been through this and it's just disappointing. And no, it doesn't mean that because we experience it that you somehow become immune to it. We don't.
Our God is not
We hurt
crazy
each
at all.
time that we experience it. We hurt even more when our children experience it because they're kids. And just as kids can be taught to hate, I'm
God
teaching
is
mine
holy
to love themselves
and
and the heritage from which they come from, and the color of their skin, and the humanity that they possess. And no, I do not need to justify my existence by being a doctor or medic.
It makes
But it is
us
harmful
angry
to
hear someone
experience
make
harm
a mockery
and then be expected to provide care
of the Lord
in
our
that same
God.
environment. And that's where we're going to. Anyway, thought I might just let you.